Welcome back. Today, let's discuss more research on probiotics, and in this case, how probiotics can improve immune system function, oxidative stress, and even asthma and allergies as kind of subsets of inflammation, probiotics for kids, acute diarrhea, newborn health, and also respiratory infections in children. And then finally, finish our discussion with probiotics for gut health, the latest updates on IBS, constipation, and H. pylori. Welcome to Dr. Ruscio Radio, providing practical, science-based insights into health, exploring the importance of nutrition, lifestyle, and gut health through conversations with experts, research reviews, and personal stories. We break through the bias and the noise to bring you simple, trustworthy information that matters. I'm hoping by now it's becoming really evident that we keep a close watch on a pretty impressive and robust stream of research that's being published. And this progressively informs our recommendations and hopefully is helping you fine-tune the use of probiotic, either supplementation or, as an aside, consumption of food. Most all of these studies actually today are on supplements. But don't let the fact that there is a fairly impressive body of data with supplements lead you to forget to make fermented and probiotic-rich foods a routine part of your diet. Okay, so let's jump in. Probiotics and immune health, inflammation, and allergy. This study looked at oxidative stress, kind of a way of saying inflammation, in healthy individuals. A meta-analysis of 9 randomized control trials, providing us a good overview of across, again, 9 trials, what is the aggregate finding. The fact that this is done in healthy subjects is noteworthy because it answers the question, well, maybe I don't have a full-blown disease or syndrome, inflammatory bowel disease, irritable bowel syndrome, and maybe I'm wondering if I could derive some benefit from probiotics, perhaps knowing that they had this immunomodulatory effect, reducing the amount of inflammation that can ensue from problems, namely in the small intestine, as we've discussed so many times in the past. So maybe there's some anti-inflammatory, antioxidant benefit I, as a somewhat or totally healthy person, could derive from supplementing with probiotics. The intervention was either placebo or probiotic, because remember the placebo has to be factored out, so hence placebo-controlled design, great stuff. They looked at probiotic dosages that ranged from 1 billion all the way up through 200 billion. So a fairly large dose range was experimented with across these various trials, and the duration of these studies was between 1 and 3 months on average. What did they find? Well, excitingly, they found that probiotics led to reductions in oxidative stress with a moderate effect size, increased antioxidant capacity with a large effect size, and increased levels of what's called the master antioxidant, glutathione, with a small effect size. So really exciting. And now let's look at what might be happening underneath the surface that's allowing probiotics to lead to less oxidative stress and better antioxidant status in otherwise healthy individuals. And that's what you're seeing here, schematic from another journal paper. And a few things happen. When you have a poor diet, they're saying high fat here. In some of the research, you'll see these researchers don't like high fat. Some may not like high processed food. So I would take this with a grain of salt, right? I think the cheeseburger depiction to denote perhaps processed food would be a better standard, maybe saying a unhealthy diet, a high processed food diet, because we could also say a diet high in carbohydrate, too high in carbohydrate could be inflammatory. So if you're not eating a reasonable balanced diet, or if you're smoking, or if you're using certain drugs that are known to have oxidative side effects, or maybe even recreational drugs like smoking, you don't have good circadian health, meaning day-night rhythms, including sleep. All of these things can decrease bacterial diversity and interfere with the health of this very important, mucous membrane, most namely in the small intestine. And when this membrane is not healthy, it becomes too or hyperpermeable, leading to leakage. This is leaky gut, as it's also described. And remember, on the other side of the gut membrane waits your immune system. And if the immune system is called into act, you now have oxidative stress. So all of these factors congeal together to lead to an unhealthy gut, leakage, and immune system mediated inflammation leading to oxidative stress. But the story doesn't stop there. When you do have this inflammation and immune system that's being called in to clean up some of this leaky gut mess, there's a dysregulation of the immune system leading to an inflammatory cycle. And the cycle is one of the key things here. We've discussed on the podcast in the past that these cycles can be self-perpetuating, meaning, let's say some of these unhealthy diet and lifestyle factors are present, gut health is impaired, that leads to this leakage, that leads to oxidative stress and inflammation, and this starts sort of a wind-up phenomena where the gut becomes even more leaky due to the inflammatory response, and then maybe even otherwise healthy foodstuffs start triggering this response, and you have this sort of runaway schematic here of the inflammatory cycle. Now, the good news is that this is very able to be remediated, and that's what we're seeing in this last study, wherein they found, again, a meta-analysis of 9 trials finding reductions in oxidation. So even though the pathophysiology can look scary, it's meant to help you understand how much power you have in your hands with dietary, lifestyle, and in this case, supplemental protocols using probiotics. If you're liking this video, please comment, subscribe, like if you're feeling ambitious, all 3. The comments, I really do enjoy reading and seeing what's important to you guys, and I'll do my best to respond to as many of those as I can. Along with the theme of inflammation, oxidation, kind of different sides of the same coin, asthma is one condition that would fall within this umbrella. This next study, randomized control trial, 40 asthma participants were given either placebo or probiotic. They didn't specify in this paper the specific formula, so I can't report on that for you. But when comparing the probiotic to placebo, they did find improvements in asthma symptoms and in inflammatory markers. Remember, we just talked about that, namely interleukin-6 and interleukin-17. And these researchers concluded, and I'll quote here, oxidative stress is implicated in asthmatic inflammation and severity. So remember that inflammation and oxidative stress and the immune system are all part of the same bundle. And what appears to be happening here is that a orally consumed probiotic is modulating the immune system systemically, so much so that asthma, which might be predominantly, not exclusively, but in large part due to reactions to environmental stimuli and or just these internal inflammatory cascades that something like stress or exercise might trigger. So really good news here, especially wanting to point out to you that a successful gut intervention can have wide-ranging positive impacts on your health. And a similar study, do probiotics improve seasonal allergy symptoms? Randomized control trial, 142 subjects who had seasonal allergy, given either placebo or a probiotic. In this case, it was a blend of Lactobacillus and Bifidobacterium species at a dose of 8 billion CFU, kind of a middle of the range dose. Now, in this paper, they did not find that probiotics led to any difference in allergic symptoms. So we always want to report on these data and not sort of cherry pick. However, that being said, we also want to juxtapose one study with the larger body of evidence. So in this case, a different paper, systematic review of 56 randomized controlled trials, quoted as follows. The present review showed that there is considerable evidence that probiotics are useful in the treatment of allergic rhinitis. So there can often be a mixture of findings in a data set. What we want to do is look for the trend. And that's why we will examine randomized control trials, but hopefully, as you're becoming accustomed to, we're often looking to more summative pieces of science, systematic reviews, and meta-analyses when we have the luxury of having them, which we do in this case. So I would say for asthma, or specifically for allergic rhinitis, I would certainly consider a probiotic. Now, coming over to probiotics for kids, a few studies here that I'm really excited to share with you. All right, firstly, should probiotics be used to treat or to prevent acute diarrhea in children? Either healthy children or kids with acute diarrhea were examined in this meta-analysis of 9 randomized controlled trials, placebo versus probiotic intervention. The probiotic was Lactobacillus reuteri at a dose of either or anywhere between 100 million to 100 billion. A point to underscore here is that the dose range used in studies, like with adults, for children is fairly wide. I mention this because sometimes in our consulting practice, a parent, rightfully so, is concerned that there's a very specific and narrow dose range to use for children, and if they don't, they might do unintentional harm. And that doesn't seem to be the case, again, because we're seeing a wide range, 100 million fairly low, 100 billion fairly high. What did they find? Compared to placebo, probiotics led to a reduction of days with diarrhea, reduced severity of diarrhea. However, there was no ability to prevent diarrhea. Also, just to quote the paper and to speak to maybe a concern of parents, no adverse events have been observed. So that's obviously great news. And just to refresh your memory on a different paper that we've quoted and sort of run through the schematic from a few times on the podcast in the past, there's a number of reasons why probiotics protect your system from infectious bacteria. Enhancement of the epithelial barrier, like we discussed before, that very important selectively permeable or absorptive membrane in the small intestine has better barrier function. The inhibition of pathogens or bad microbes from being able to take up residence in that lining. Competition, meaning the good bacteria crowd out the bad guys. And also direct production of antimicrobial substances. And then finally, tied in with all of this, we see a beneficial modulation of the immune system. Because sometimes what happens is an organism that your body can clear in a couple of days and is self-limiting, then leads to this runaway inflammatory response. This is part of the hypothesis behind how irritable bowel syndrome, IBS, starts. There's a transient, self-limiting pathogen that causes acute diarrhea and or vomiting, acute gastroenteritis. And then followed by that, there is a long-term inflammatory response. So I want to keep bringing your attention to the importance of the modulation of the immune system. Looking at some other data regarding acute diarrhea in children. This paper was a meta-analysis of 12 randomized control trials. And what they found in the subgroup analysis, combined probiotics shortened the duration of diarrhea compared with single probiotic use. So just to tie this together, coming back to the first study, this was a Lactobacillus reuteri, right? A single species. Sometimes what happens is when people hear about this research with a single species or even strain, they think, oh my goodness, I need to have that one species or strain. And this doesn't really hold up to scrutiny, as evidenced by this paper that we just covered in the subgroup analysis, combined probiotics. This means multi-species formulas shorten the duration better than the use of a single species or single strain probiotic. I share this because the unfortunate pressure I see consumers confronted with is a company funds a study, sometimes for a very specific formula or even very specific species or strain. And then they want to push that information out into the world, rightfully so, teaching you about that one study, that one product, that one species, that one strain. However, if you're not also being given a meta view, you could miss the fact that there's not necessarily a magic formula for the diarrhea or whatever it is. And we have another study we'll cover in a moment that supports that same thing. And again, it's just important for you so that you don't get hoodwinked by the marketing claims that this is the best probiotic for children with diarrhea. This is the best probiotic for, let's say, constipation. It doesn't seem to be that specific. Probiotics are not drugs. Probiotics help to fix issues in the gut. When you correct those, many things then follow. Moving on to the next study here. And this one I found really compelling. Can probiotics improve jaundice in premature babies? This study looked at premature infants with jaundice, and they were given either phototherapy or phototherapy plus probiotics. The probiotic used here was Saccharomyces boulardii at a dose of 1.3 billion per day. Now, the addition of probiotics led to a faster resolution of jaundice, 7 days shorter, pretty remarkable. A shorter duration of phototherapy required, 2 days shorter, and improved stool frequency and form. If your child had jaundice and you found yourself in this position, in the hospital with a phytotherapy unit and your child in this sort of compromised position, I could see it being very easy to be afraid and just follow the recommendations of the local hospitalist, the local nurse, which I think are doing fantastic work, but they may not be up to speed on this research. And so when you say, hey doc, hey nurse, can we give my child a probiotic? Will that help? They may say no, because they're afraid that that could do harm. Totally understandable. However, it's incumbent upon you to do your own research and have these conversations with your doctor. Part of the reason why this study found improvements in jaundice when using probiotics in admittedly a sort of scary setting that I don't think any parent wants to be in, they found benefit. Now, why is that? It's because the infant microbiome is higher in a few bacteria, most namely E. coli and staph. These bugs produce beta-glucuronidase, and this can be a factor leading to the formation of jaundice. Now, Saccharomyces boulardii has been shown to reduce the activity of beta-glucuronidase by reducing levels of E. coli and staph. So I just share this because it would be disheartening to watch a child have to stay in the hospital or go back to the hospital for phototherapy 2 days longer, or maybe be able to resolve the issue 7 days more quickly, as this study found. And I don't always think that the great people working in the hospital who you want there to help you when you need acute care are going to know everything about everything all of the time. And so this is where you can bring your own information to the table. Always do so with a bit of tact, because people are human, right? And if you come at them aggressively, they may just push back. So anyway, if you find yourself in this position, something to discuss with your healthcare provider. Also, just for a reference point, how does the 1.3 billion dose used for the infants compare to our recommendations, which are evidence-based, for supplementation in adults? Well, here they are. And the Saccharomyces boulardii is between 10 to 15 billion. Now let's translate that to, well, I'm an adult, I have a probiotic, my kid gets sick, how do I give the probiotic to them successfully? Again, always check this with your healthcare provider, but you're going to need some information to help guide them. Here is a product, the Saccharomyces boulardii product we use. 2 capsules equals 6 billion. So what you could do is give your child about 1/3 of 1 capsule. And this is the general recommendation that I think works for kids, including infants, as a fairly simple meta protocol. Use anywhere from 1/4 to 1/2 of the adult dose. So that's how you could translate this in this case. And it's not a special Saccharomyces boulardii for kids. It's the same probiotic, just at a lower dose. Remember the other study that we looked at that used 100 billion in children. So there is a range. And again, I just share this because there's not necessarily this super narrow range that you have to use for kids, or you might do unintentional harm. So anyway, in this case, you could use a third of one capsule that you might be using as an adult for your child. Again, always check these things with your doctor, but bring to them information to help them make an evidence-guided decision, because your healthcare provider may not be comfortable saying, use the probiotic, because remember, it could be their butt that gets called on the carpet if something bad happens. However, if you show them, hey, here's a meta-analysis or a clinical trial, here's what they found, what do you think given this data and the fact that my child needs phototherapy? Okay, so just have these conversations with your healthcare team in a respectful but also data-driven fashion that should lead you to the best outcome and the least amount of friction or pushback that you get from your healthcare team. Okay, moving on. Do probiotics help with prevention of respiratory infection in infants? We've discussed a number of trials in the past demonstrating that for adults, the answer is yes. What about infants? Observational trial, so it's not going to be as accurate of data if it's observational. That means there's no placebo control. So placebo here is unchecked. Looking at Lactobacillus rhamnosus, the dose was not listed in this trial, given only for the first 6 months of life, and then they were monitored for 2 years. And they found that at the 2-year follow-up, probiotics did not reduce the frequency or severity of upper respiratory tract infections. This comes from some other research that found, and that has found, that probiotic use early in life may lead to benefits after discontinuing the probiotic many years in the future. I think it's a tall ask of a probiotic, and what you're seeing here is, again, what you did up to 6 months may not protect you even if you stop up through 2 years. And with that in mind, I did want to share a few other similar studies looking at respiratory infections in children and probiotics, and you do see a reduction of incidence, a reduction of duration. Not all the data here agree, but I think would certainly be one thing to consider when trying to protect your child. And then to close this out, probiotics and gut health, looking at IBS, constipation, and H. pylori. The first study here, what does the latest evidence show for treating IBS with probiotics? Meta-analysis of 6 trials looking at placebo versus probiotics. Now, again, being a meta-analysis, the formulas are going to differ across trials, as will the dosages. You saw some studies using a soil-based probiotic, some using a blend of lactobacillus and bifidobacterium, some using Saccharomyces, in this case, cerevisiae. Compared to placebo, probiotics led to a reduction in abdominal pain with a large effect size, an improvement in bloating with a small effect size, and no difference in IBS severity or in quality of life. So mixed data as it pertains to probiotics for IBS. Now, there's 1 or 2 things about this study that I think are a little bit problematic due to the fact that we're summarizing 6 different randomized control trials. The setup in the trials differed. Some of the studies had patients who were on a low FODMAP diet, then either add placebo or probiotic. These studies did not find improvements in IBS. Other studies did not have them on a diet and just went on to either a placebo or a probiotic. Those did demonstrate an improvement in IBS. The confounding variable of baseline low FODMAP dieting might be why we see no difference in IBS severity scores, even though irrespective, there was an improvement in pain and bloating, which I think any IBS patient would gladly take. Now, juxtaposing that against 3 other meta-analyses looking at 123 studies, you do see improvements more globally with IBS. So we'll just continue to watch the data here. Data are mixed. I think that should be no surprise. If you see uniformity across all trials showing benefits of all domains, that is incredibly rare. In fact, I can't even think of one area wherein that's the case. So I just share this because what you can see, and this is something that frustrates me sometimes when I speak with academics, they will cite one trial and they'll really double down on details of that one trial, but they're misinformed regarding other good data points. And I've mentioned so many times in the past, Daniel Kahneman's argument that smarter or people with more expertise are no less amenable to bias. They just make more convincing arguments. So this is where I think data is a real truth serum. And in this case, the preponderance of the evidence still suggesting a good signal for benefit when using probiotics for IBS. This next trial asked the question, do probiotics improve chronic constipation? Placebo versus Lactobacillus plantarum P9. So the P9 is the species designation, which I've said in the past does not seem to matter, and I'll reinforce that here in just a second. Using a dose of 100 billion per day, this is a high dose, after 1 month compared to placebo, probiotics demonstrated improvements in bowel movement frequency, less straining, and less worry related to constipation. Okay, let's come back to the strain specificity piece, the P9 designation. A similar trial did a head-to-head comparison of P9 versus 299V. So both were the species of Lactobacillus plantarum. One was the strain P9, the other was the strain 299V. What do you know? They found that Lactobacillus 299V also improved constipation. So either strain improved constipation. This is why I've continually said I don't believe, and the data don't seem to support, that the strain specificity matters, but rather my observation has been this is due to market pressures. The company that makes the P9 is incentivized to tell you that is the best formula. And if the academics and the researchers don't catch that, they can end up parroting the same thing. So that's my perspective on this, given the fact that we're seeing a growing body of trials showing that when we pit different strains against each other, we see similar outcomes. Therefore, it would suggest the null, that the strain specificity or the designation does not matter. Probiotics are not that complicated. You don't have to jump through hoops for this one special formula for constipation and a different one for allergy, because if you use the probiotics effectively and they fix a problem in the gut, that will fix diarrhea for some, constipation for others, brain fog for others, allergy and oxidative stress for others. One other point to share with you regarding the use of probiotics for constipation is this is one of the exceptional cases wherein it may take a little while longer to experience the benefit. As this trial demonstrated, it wasn't until the 2-month mark that you saw the scoring of constipation improve in the probiotic group as related to the placebo group. And that might be because of all the mechanisms through which probiotics improve the gut. That process may take time to then have a spillover effect downstream of improving bowel regularity. So just be a little bit patient. I think if you're not seeing improvements by 3 months on a probiotic, you've definitely satisfied the experiment. And usually you'll have an indication within a month. Constipation might be one exception to that rule, where 2 months may be how long you have to wait before you can really successfully appraise the efficacy of that therapy. And then final study here, do probiotics help with Helicobacter pylori, a bacteria that resides in the stomach, can cause ulcers, may cause GERD and reflux, although the data there are getting more and more mixed with every passing couple of years. This case, meta-analysis, 17 studies, looking at standard therapy with antibiotics and acid suppression as compared to standard therapy plus probiotics. They used a blend of Lactobacillus, Bifidobacterium, Enterococcus, and soil base, so a really sort of broad mixture in this case. And the addition of probiotics led to a 3.7 times greater eradication rate, less abdominal pain, and fewer medication side effects, most namely bloating, diarrhea, nausea, and vomiting. As I've said so many times before, if you're taking an antibiotic, it's usually a great idea to take a probiotic with it because they are synergistic. Again, always check this with your healthcare provider, but the data here are very clear and very compelling. There's a very strong trend line showing that you will have less antibiotic-associated side effects and you'll have a better clearance of whatever infection or imbalance like SIBO you are trying to treat. Remember, we discussed in the past meta-analysis data showing that rifaximin, antibiotic or SIBO, has about a 50% clearance rate for SIBO. Probiotics have also about a 50% clearance rate. When you combine them, you get about a 85% clearance rate. So combination therapy, antibiotic or let's say herbal antimicrobial combined with probiotics seems to be a winning combination. Okay, well, that is the update or updates on some of the latest probiotic research. I hope this helps you understand a number of things. One, the far-reaching impact that probiotics can have on everything from constipation through allergy and even oxidative stress in healthy individuals, and that you don't need to have a uber-specific formula, and also that for children and even infants, there's growing data that you should have at the ready if you do find your child or infant in the need of acute medical care, so that you can educate your hospitalist, your doctor, on how probiotics might be able to synergize with that more conventional medical acute care. All right, guys, so this is Dr. Ruscio. Hope this helps. Talk to you next time.